You are standing over the toilet bowl, waiting. You feel the pressure building in your lower abdomen. You know your bladder is full, but nothing is happening. You push, you strain, and finally, you get a weak, hesitant dribble that stops and starts, leaving you feeling frustrated and incomplete. You might think this is just part of aging. Or perhaps you have been told that medication is your only option. You are wrong. In fact, the very muscles you are using to try and force the urine out are likely the ones trapping it inside. Today, I am going to teach you a physical manipulation technique, a specific 1-minute massage protocol that creates a neurological reflex to open the urinary sphincter instantly. It is not a pill. It is not surgery, and it is rarely taught in standard 15-minute clinic visits. My name is Dr. Emily Carter. I am a board-certified urologist with 25 years of experience treating men for prostate health and urinary retention. Throughout my career, I have seen thousands of men suffer unnecessarily because they treat the prostate like a simplified plumbing problem rather than a complex neuromuscular system. I am here to give you the information that usually stays behind the closed doors of expensive specialist consultations. Let me tell you about a patient of mine named Arthur. Arthur was 68 years old when he came to my clinic, and he was exhausted. He was a dignified man, a retired engineer who prided himself on solving problems, but he could not solve this one. Arthur was waking up 4 or 5 times every single night to urinate. He would stumble to the bathroom, stand there for minutes at a time, and produce almost nothing. His quality of life was plummeting. His previous doctors had put him on alpha blockers, common drugs like tamsulosin. While they helped the flow slightly, they gave him dizzy spells and retrograde ejaculation, which terrified him. He felt he had to choose between his sexual function and his ability to pee. He was doing what he thought were pelvic floor exercises, squeezing as hard as he could, but his symptoms were getting worse. Arthur was desperate. He looked at me and said, "Doctor, I just want to empty my bladder and sleep." Here is where we need to dismantle the enemies of your prostate health. The first enemy is the misconception about the pelvic floor. Most men have heard of Kegel exercises, and they think that to improve bladder control, they need to strengthen and tighten these muscles. If you are having trouble emptying your bladder, doing Kegels is one of the worst things you can do. When you have an enlarged prostate, your pelvic floor is often in a state of chronic spasm. It is already too tight. By doing Kegels, you are tightening a knot that is already choking your urethra. You do not need strength, you need release. The second enemy is the reliance on forcing the flow. When you strain your abdominal muscles to push urine out, you trigger a reflex called the guarding reflex. Your body senses the increased intra-abdominal pressure and instinctively tightens the sphincter to prevent leakage. You are literally fighting your own biology. You push down, and your body closes the door. The third enemy is inflammation caused by what I call blind supplementation. I see men taking handfuls of generic prostate supplements filled with low-quality saw palmetto and zinc oxide that their bodies cannot, quote, absorb. These cheap fillers can accumulate and cause gastric inflammation, which, due to the proximity of the bowel to the prostate, actually increases prostatic swelling. Now, let us talk about the heroes. The solution lies in manually overriding the nervous system's signal to hold urine. We need to trigger the parasympathetic nervous system, the rest and digest mode, specifically in the pelvic region. We do this through a technique I call the Suprapubic Release Protocol. This involves stimulating specific acupressure points and using mechanical vibration to relax the bladder neck. The biological mechanism here is fascinating. By applying specific, rhythmic pressure just above the pubic bone, we stimulate the sacral nerve plexus. This sends a signal directly to the detrusor muscle of the bladder to contract, while simultaneously signaling the external sphincter to relax. It is like flipping a switch. We are bypassing the obstruction caused by the prostate by coordinating the muscles properly. Here is the protocol. You need to listen closely because the technique matters more than force. You will perform this protocol every time you struggle to initiate urination, and specifically right before bed. Step 1 is the warm-up. If you are at home, I want you to use warm water. A warm washcloth placed on the perineum, the area between the scrotum and the anus for 30 seconds, helps relax the deep pelvic tension. If you are in a public restroom, you can skip this. But at home, do not neglect it. Step 2 is the trigger point massage. Place 3 fingers of your dominant hand about 2 inches below your belly button, directly above your pubic bone. This is where your bladder sits. You are not going to poke it. You are going to apply steady, firm pressure inward and slightly downward toward your feet. Hold this pressure for 10 seconds. Step 3 is the manual vibration. While maintaining that pressure, begin a gentle, circular motion with your fingers. Go clockwise for 10 rotations. This movement manually stimulates the bladder wall. Step 4 is the release point. This is the secret weapon. Take your other hand and reach behind you to your lower back, right where your spine meets your pelvis, the sacrum. Use your knuckles to rub this area vigorously up and down for 15 seconds while you continue the circular motion on the front. This dual stimulation hits the nerve roots on both sides. While you do this, you must engage in diaphragmatic breathing. Inhale deeply through your nose for 4 seconds, allowing your belly to expand outward. Do not let your shoulders rise. Exhale through your mouth for 6 seconds, as if you are blowing out a candle. On the exhalation, that is when you attempt to release the urine. Do not push, just let go. For Arthur, this was a revelation. But we had to support this physical protocol with biochemistry. This brings us to synergy and sabotage. To create synergy with this massage, you need to soften the prostate tissue itself. I prescribed Arthur high-quality stinging nettle root, specifically 300 milligrams, taken twice daily. Stinging nettle binds to sex hormone-binding globulin, freeing up testosterone and reducing the estrogen dominance that contributes to prostate growth. We also added pumpkin seed oil, but not in a capsule. I had him take 1 tablespoon of raw, cold-pressed oil directly. This provides a massive dose of bioavailable phytosterols and zinc. Now for the sabotage. You must stop drinking fluids 2 hours before bed. But more importantly, you must eliminate what I call the bladder irritants after 2 in the afternoon. No caffeine and absolutely no alcohol. Alcohol acts as a diuretic, filling your bladder rapidly, but it also acts as a depressant that dulls the nerve signals, making it harder to wake up until your bladder is painfully overfull. Let me walk you through the timeline. When Arthur started this, the first 3 days were about learning the technique. He felt awkward, but by day 4, he noticed he didn't have to stand at the toilet for 2 minutes, waiting for the flow to start. By the end of week 1, using the massage and the stinging nettle, his stream was stronger. He was emptying his bladder more completely, which meant it took longer to fill up again. By week 3, the inflammation in his prostate had subsided significantly due to the oil and the lack of alcohol. The nighttime awakenings dropped from 4 times a night to just 1. And finally, by week 6, Arthur came back to my office. He looked like a different man. He was sleeping 6 to 7 hours straight. He told me, "Doctor, I have my life back. I can go on long drives without panicking about rest stops. I feel like a man again." His post-void residual volume, the amount of urine left behind after peeing, had dropped from 150 milliliters to just 30 milliliters. That is a healthy bladder. So here is my challenge to you. For the next 30 days, I want you to stop straining, stop fighting your body. Commit to the suprapubic release massage every single time you use the restroom. Add the tablespoon of pumpkin seed oil and cut the fluids 2 hours before bed. Do not just watch this video and nod along. Try the technique the very next time you need to go. You will feel the difference in the release. It is instant and it is powerful. Your body has the ability to heal and function correctly, even after 60, if you give it the right inputs. Thank you for watching. Stay healthy.